Guys, Botox is always a must when you're doing CO2 laser resurfacing. And the reason it's really important before CO2 to do Botox is because you want to prevent those areas that we're going to do laser resurfacing on to move. And so you get much better results out of your CO2 laser resurfacing. So here we're doing CO2 laser resurfacing of the eyes. As you can see, I've already inserted the stainless steel metal eye shields in both eyes. The patient doesn't feel me putting those stainless steel metal eye shields in the eyes because we use numbing drops. So the procedure is completely painless and actually it is not felt by the patient. I then go ahead and use the resurfacing handpiece of the CO2 laser. In this case, we are using the Fraxel Repair CO2 laser. And here I'm using the eye handpiece and we're resurfacing the entire lower and upper eyelids in a methodical manner. The resurfacing handpiece is nice for fine lines and moderate lines. It's also nice, it improves texture as well as skin tightening. In addition to the regular resurfacing of the handpiece, I'm a big fan of the 2mm handpiece of the CO2 laser. The 2mm handpiece of the CO2 laser can be used both for destructive modalities, and here's the 2mm handpiece, and it can also be used for tightening. This patient also has xanthelasma, so we are also going to destroy the xanthelasmas on both sides with the CO2 laser prior to using the 2mm handpiece for tightening. So here, xanthelasmas, as you can see, is a collection of yellow plaques. These are made up of lipids. It's a genetic trait. It's usually not associated with high cholesterol lipids, although most dermatologists recommend to check your blood work, but we really never find any type of association. So I do multiple passes on the xanthelasma, and then I use a Q-tip to wipe away. Then I use the same handpiece for tightening of the lower and the upper eyelids. The 2mm handpiece is one of the wonder pieces, handpieces of lasers, because there's no other laser that can tighten up skin like the 2mm handpiece of the CO2 laser. Here we're free-handing this, the 2mm handpiece. We try to put it as close to each other as possible for the best tightening results. The reason I love the tightening results with the CO2 laser is because the heat of the laser and the CO2 laser is an extremely hot laser, causes a 3-dimensional lift, whereas when you do surgery, it's only a 2-dimensional lift, and that's why CO2 results are so amazing. A lot of my patients that see me for CO2 lasers around the eyes don't really need the CO2 laser on the rest of their face because they're rather young, in their 40s and 50s, and we choose to combine the regular Fraxel laser. This is the Fraxel Restore Dual laser on the rest of the face and the neck. And this combination of CO2 laser around the upper and lower eyelids and the regular Fraxel laser on the rest of the face is extremely popular among my patients in their 40s and 50s, as the CO2 laser does the tightening, and for the rest of the face we use the Fraxel laser, which has the easier recovery time for improvement of texture, sun damage, and fine lines. This combination is an absolute home run in the right patient.